Hi, I'm Ashley Casvan, Executive Director of the Responsible AI Institute.
And I'm Melissa Lefebvre, Director of Partnerships and Market Development with the Responsible AI Institute as well.
Hi, I'm Jessica Levesque. I'm the Executive Director at C4, and I'm excited to do the Melanoma Challenge.
Hi, and I'm Josh McDougall, also from C4. Can't wait to do the Melanoma Challenge.
Is this melanoma or not?
Ew, it's just icky.
Well, it looks crunchy. I don't know. Is melanoma crunchy?
Is melanoma
looking?
crunchy?
And it looks like there's some like fuzziness around the edges, which shows like different coloring.
Mm-hmm.
I'm gonna guess. My guess is that this is melanoma.
Oh, I think it's not.
Yes, I hope so.
Yeah, this looks horrible. I'm gonna assume that's something you need to get checked out. I don't know.
Yes.
Let's go with
yes.
vote. My vote's yes.
I think the biggest thing is the one color. Like it seems to just be one color.
But look around the edges. It's sort of like kind of like lighter.
I'm ready to find out.
Yes.
Oh!
No.
What?
What the hell is that? Is it like dried food
Is it
or
actually?
something?
Is it a chard?
I think it's just like one color. And those borders are pretty defined, don't you think?
That's interesting. I totally would have thought something that was that abnormal looking would be melanoma.
Tell me what it is, please.
It is a benign keratosis.
Okay.
What's that?
Hello everyone, my name is Keith Liu and I'm the CEO and co-founder of Skinopathy. And we are in the business of helping people get the medical attention they need for their skin conditions. We've created an AI that can screen for skin cancers or measure the intensity of your acne. And we also create a virtual health platform that connects you with physicians quicker than ever before. And this evening, I'm proud to share that Canada's and quite possibly one of the world's most preeminent dermatologists, Dr. Jerry Tan, will be doing an Ask Me Anything right here live. So don't hesitate to send us your questions in the comments and listen as Dr. Tan shares his incredible insights into the world of dermatology. Thank you. We hope you enjoy the stream.
GetSkinHelp is your skin health champion. We use virtual health to bring the doctor to you. We developed artificial intelligence that allows you to screen for skin cancers and other diseases from anywhere. And now we're working with the government so that you can always have your health data stored on your phone. We're doing this all because we understand that you are the patient, and you should always feel in control of your health.
Hi everyone, thank you so much for tuning in to our live Q&A this evening. My name is Olivia, I'll be your host for the evening, and I work at GetSkinHelp. GetSkinHelp is a virtual health platform created by Skinopathy that allows you to see a doctor or nurse practitioner about your skin concerns. We can help with all skin concerns, including acne, psoriasis, skin cancer, sunburns, and more. If you think you have a suspicious skin concern, then make sure to visit our website and book that appointment. Our service is available to anyone residing in Ontario, and it's free with a valid Ontario health card. And today, I am thrilled to be joined by Dr. Jerry Tan. Dr. Tan is a dermatologist and the president of the Acne and Rosacea Society of Canada. He is also a professor at the Schulich School of Medicine and Dentistry, as well as Western University. And he is the creator of Patient Decision Aid, an online tool that can guide you through the process of managing your acne, psoriasis, and even one coming soon for rosacea. Hi, Dr. Tan. It's great to see you.
Hi, it's a pleasure to be here, Olivia. Great to be here with you.
I'm super excited. So before we get started, I just want to go over a few housekeeping items. Before this live stream started, we watched a video on the melanoma challenge that featured both Ashley Casavan and Alyssa Lefebvre from the Responsible AI Institute, as well as Jessica Levesque and Josh McDougall from the Cryptocurrency Certification Consortium. So throughout the live stream tonight, we will be watching episodes 2 and 3 of the challenge, where we are guessing if something is melanoma and not. And feel free to participate in the chat function as well. We are also joined behind the scenes by our production team. They'll be keeping an eye out for any tech issues, incoming questions, and making sure that we're doing okay. Richard, would you like to say hello?
Absolutely. We're very thrilled to have Dr. Tan here. We have a full team behind the scenes on YouTube, on Facebook, and on LinkedIn. So yes, send us your comments. And more than anything else, take full advantage of having one of the world's best dermatologists answering your questions without having to wait 6 months to see him.
Yeah, so as Richard just said, since this is a Q&A, make sure you ask your questions in the chat for Dr. Tan to answer. And finally, make sure to visit our website, www.getskinhelp.com, if you think you need to get your skin concern checked. So now let's get started. So the first question, Dr. Tan, is, are high-end skincare products better than drugstore ones?
Oh, that's a great question, Olivia. One of the major aspects of skincare brands is how they're moving forward with innovation, new products, and many of them are moving forward with science. So to my way of thinking, a high-end brand, however you define that, whether it's based on price or brand name recognition, really you should only trust it if you find that it comes from a brand you know. Number two, they have evidence to support what they say it does. And number three, when you use it, you like it. So is it worth it? Well, it depends on you. And it's going to require a little bit of homework, a little bit of digging to try to understand which product lines are best for you. Now, I do have to tell you, remarkably and reassuringly, a lot of very good brands are actually in department stores and drugstores and Costco. So I don't think you have to be getting the bougie brands or ordering them from Korea to get really good skincare brands these days.
That's really great to know, because the drugstore is my favorite place. So I love knowing that their products are just as good as something from, say, Sephora or, a higher end store. That's awesome. The next question is, are there certain signs that we should look out for when it comes to something like psoriasis versus skin cancer?
Well, the cancer issue is really critically important. So what I watch out for and inform my patients about is if they have a spot that is rapidly growing, it hurts or it feels unusual compared to the other spots they have, but it has unusual colors and it behaves oddly, like it starts to bleed all by itself, then have that checked out, because melanoma, although that was in the little video clip, is actually one of 3 common skin cancers. And the most common one is actually basal cell. And basal cell has a very different appearance than melanoma. It looks like apple jelly and it's got this waxy appearance. Oftentimes, patients are brought to focus on it because it starts to behave oddly, like it bleeds by itself and without scratching and so on. Now, alternatively, a condition like psoriasis, for example, when you have a condition like that, sometimes it can start with just 1 or 2 spots, and you might not have a flurry of extensive marks of psoriasis, but you might have a history of psoriasis. You might have a family history where other of your family members, your dad, your mom might have psoriasis, so you recognize it from that. And psoriasis typically is very well demarcated. You can see where it stops, where it starts, and it's very red, and the surface has this whitish scale. So part of what we do as dermatologists is we have to develop a catalog in our brains of what we've seen that looks dangerous and what is not dangerous, including what was called the potato chip crunchy, I think, in the video clip. So much of what we do then is in our brains through our training and through our experience. We've got these mental catalogs of what we suspect is problematic and what we feel is very likely not. And what's happened much more recently is the use of artificial intelligence and these kind of deep learning processes to understand how to also do that from images.
Awesome. That's super interesting and exciting to know. If you think you have psoriasis or skin cancer, you can book an appointment with GetSkinHelp to get that checked out. Next question is, are there any basic routines we should take up to promote better skin health?
Well, there's nothing better for better skin health than better health. So I think we start there, because sometimes we get all focused on the skin and we kind of forget about the rest of the body. So adequate sleep, exercise, nutrition, mindfulness, attending to stress, I think all of those are actually going to be even the critical underpinnings of good skin. And once you have those underpinnings, and along with that, you can also develop a good skincare routine, including the notion that certain things are going to harm you overall. Okay. And the most common that we run across are going to be pollution, cigarette smoking, and of course, UV light. So there's a little bit of a balancing act that we need to do, which is that sunshine is good for you. And yes, I'm a dermatologist, and I just said that. And you're thinking, what? He's a derm. Why is he saying that? Well, it's because they write songs about, walking in sunshine. They don't really talk about that walking in raindrops, except for that one very memorable melody. But part of the reason sun is so important to us is because it's terrific for your mental health. But like anything else, you wouldn't necessarily want to walk in the sunshine without some protection for your skin. It's kind of like driving in your car without insurance for your car and any bodily harm. So it's the same idea. You want to maximize the enjoyment feature, but you also want to make sure you have that risk part taken care of.
Yeah, I get that. Makes a lot of sense. And it's funny that you mention sunshine being good for our mental health, because now that it is fall, I can definitely tell that it is not summer anymore.
Well, remarkably, when studies are done about how long people live, comparing those who had a cohort of patients who had fairly high amounts of sun exposure compared to those who didn't, what happened was the ones who had more sun exposure had more skin cancers. But the ones who had the higher levels of mortality were actually the patients who had more sun exposure.
Interesting.
So, it's a matter of getting outside, getting in the sun, but protecting your skin. So I think that's kind of the way to look at it for your mental health, for your mortality, for, quite frankly, your blood pressure, because that is seemingly what happens when people get more sun. It's not vitamin D. It's actually related more to the blood pressure lowering effect of being outdoors and stress reduction, and probably a chemical called nitric oxide that helps our blood vessels dilate. And by doing so, reduces our blood pressure. And by doing so, it reduces our risk of heart attacks and strokes.
Oh, well, that is very interesting. That's really cool. Thank you for sharing that. I just see here we have a question from Raza on LinkedIn, and they asked if there's an abnormal growth on our skin and it's painless, what should be done regarding that before visiting the doctor?
Well, there are a couple of things that might be helpful. Certainly, I think one of the major developments has been in the past, we've looked at these spots to try to understand whether we should biopsy them or not, because what we tried to determine is whether there's a low, medium, or high probability of something dangerous. Okay, so if it's low probability, we may want to make sure that we have a chance to discuss that with the patient and then monitor or just reassure them. If it's moderate to high probability, we may want to go on to do a test called a biopsy. Now, for many of the artificial intelligence programs that are available, including ones being developed by Skinopathy, they can be used to evaluate, again, probabilities. And the probabilities of whether this may be a concern or not a concern. So the issue is, even if it's painless, it doesn't mean that it's necessarily safe. So one of the things is, if it's abnormal, that's all we need to kind of focus on. Whether it's painful, painless, itchy, not itchy, is going to be a little bit less relevant than the abnormality. And if the abnormality is based on appearance, that is an odd set of colors, you can't see where the border stops and starts, there are irregular features within it, and there is a pattern that we call chaos. And chaos is evaluated based on the overall contour and patterning of the spot itself based on magnified evaluations of the spot. And what we do with that is we use a procedure and an instrument called a dermatoscope that allows us to magnify when we look at that lesion very, very closely.
That's interesting to know. So just because it's painless and looks harmful, it is not necessarily nothing.
Precisely. I've had a lot of patients who over the years have said, this has been on my skin for years and it's just slowly growing. It's completely painless. And it looks, when I look at it, it's completely abnormal looking, and it's a melanoma. So, don't presume that because it's painless, pain is not a great sign of danger. It's just one of the multiple signs we use to try to point us in a direction of whether we need to test or not. So the other features are what it looks like, the rapidity of growth, and then, of course, whether there are certain signs or symptoms, including pain, but pain is not a great feature for danger.
Huh. That is very interesting and very good for, I think, everyone, including myself, to know to know that. The next question is, why does my skin get drier in the winter than in the summer?
Well, it's really interesting because by the time October rolls around, all of us of a certain age, let's say, will start to find that your arms and legs start to feel a little bit drier and more itchy. Okay, so, and that happens routinely. And part of the reason for that is because of the change in seasons. And the change in seasons with a drop in humidity, there's less ambient humidity around us, which means we get less moisture into our skin. Plus, the areas that are the least able to produce oil are going to be your arms, basically your extremities. You just don't make much in the way of oil in those areas. And because of that, all of the reduction in humidity and the relative lack of oil makes you drier and drier. It's really that oil and water that keeps your skin moist. It's not just the oil and it's not just the water. If you put water directly onto skin, it will evaporate. For it to sit on your skin and stay on your skin, you need the water and then oil on top. Okay, so it sounds like a salad dressing. And maybe that's the next best moisturizer. But really, it's that combination of a water base and then an oily layer on top that keeps the moisture sealed into the skin so that the water can't evaporate as quickly.
Huh, interesting. I guess maybe salad dressing will be the next skincare trend on TikTok or something. Who knows?
Yeah, your friends might stay away from me because you smell like vinegar or something. or I don't know, maybe that's the next hot perfume. The vinegar.
That's the 2024 exactly. Trend. If you're like me and are noticing your skin is definitely getting drier because it's a lot colder and gross outside, you can visit GetSkinHelp to maybe help with any of those concerns. I see another question has come in from one of our viewers. Arnav asks, I wanted to know about an issue that I have on my left toenail. It has a horizontal dark line. It's not too dark, but it has been there for some time now. What do you think it can be, or what can be done about it?
Okay, so I think when it has a dark line, it's really important to just have it looked at. And dark lines may be nothing at all. They might be just periodic kind of invaginations where the nail root has stopped growing as rapidly and then it's picked up again. And then you get this little ridge or discoloration in the nail. Other times it may be just from trauma to the nail itself. And there are a number of other reasons, sometimes underneath the nail, there might have been a little bit of bleeding. It's called a subungual hematoma. So there are a number of different possibilities, but one of the reassuring parts about nails is nails grow out. So if this mark continues to grow out, just let it be. Because if it's a cancer, it will probably not grow out and it will persist. Then you will need to have that looked at and maybe tested. But a simple rule of thumb is that for toenails, for example, gray toenails tend to grow about 1 millimeter per month. So in 3 months, it should be growing out 3 millimeters farther from the nail root compared to where it's now. So that's a simple way to determine if it's growing out with time.
Yeah, so Arnav, if you would like to get that checked with GetSkinHelp, that'd be a great option if it's not, growing out as Dr. Tan has suggested. We have another question from LinkedIn from Dr. Ayani, who asks, for men who get razor bumps, don't want to permanently remove their hair, for example, laser, what is your approach to managing these bumps?
That's a good question, because razor bumps are a combination of different possible diagnoses. One of them is acne and folliculitis that people just shave over. And then they have all of these little red marks that they feel are related to shaving, but they're not. They're pre-existing. The other type of razor bump is where it's actually ingrown hair, and that's called pseudofolliculitis. So there's folliculitis, which is inflamed pores, and then there's pseudofolliculitis, which is from the invagination of hair sticking back into the skin, triggering a foreign body response. Now, that's the standard terminology for pseudofolliculitis equals razor bumps. To address that problem, there's actually one simple way: avoid the razor. Okay. So no razor, no bumps. That's the Bob Marley song, right? No, that's not the Bob Marley song, but I think we can sing along with that one. However, the issue is that a lot of men need to shave, whether it's for work or just the way they like to be groomed. And if you need to shave and you develop razor bumps, remember, one of the issues with razor bumps is the way your hair grows out of your skin. So, for example, if your hair grows directly perpendicularly out of your skin and you shave it, then the next hair that grows up just grows out perpendicularly. You won't get razor bumps, okay? But nobody's hair grows that way. Our hair tends to grow sideways, okay? And when you cut your hair or you shave, sometimes that hair that is now underneath the skin can't quite find the exit point again. Then it curls underneath and it leads to this bump. The other possibility is the hair that is there is curly. And that coiled hair, as it grows out, tends to grow back in. And then that leads to a razor bump, which is why there's a higher propensity of pseudofolliculitis barbae, i.e. razor bumps, in patients who have curly and coiled hair. So what do? Well, in that situation, you start with very lots of moisturizer before you shave. And then you, wherever you can, do a one-pass shave. So you're not trying to get too close in shaving. The closer you are in shaving, the hair gets pulled out, and then the elastic aspect of the hair makes it bounce back in. And once it bounces back in, now it has to find the exit again as it grows. So what you do is you try not to shave too closely because you don't want that elastic bounce back. The second part is to achieve that, you want to moisturize as much as possible, whether you use a lotion or you use foam or gel. And then when you shave, do a one-pass shave. Now, there are special blades called PFB blades. PFB blades are like standard razor blades, but they have an extra little, so let's say those are the standard razor blades, okay? This is a two-blade device, but on the blades themselves, there's a little foil so you can't get too close, okay? So it gives you a little residual stubble so that you're not getting that really close shave that leads to that pullback into the hair shaft. So that can be helpful for some patients. And of course, people can also get, electrolysis, laser hair removal if they wish.
It's great.
By the way, I wanted to address something very Canadian. I wanted to say this, Olivia, because, when you live in the Great White North, as we do, you get dry skin. I'm coming back to the dry skin part.
Oh, no problem.
I think that's such a common concern and complaint that addressing it is really going to be helpful for a lot of people. So the first thing is, don't use soap. I'm not suggesting personal lack of hygiene. I'm actually suggesting that soap is very, very drying. So you want to use gentle cleansers, and these are called technically synthetic detergents, but there are a lot of them on the market, and they're very, very gentle. They're pH balanced so that they're less problematic on skin, okay? Because soap on skin does this. It's the wrong pH, so now your skin is stressed. Number two, it removes the top layer of oil, so now you have no protection to enhance hydration. And of course, all the water seeps out because you have no sealing layer, okay? The sealant is gone. So what you want to do is you want to use these synthetic detergents that are very gentle, are pH balanced, and will be able to maintain moisture. Now, once you do that, when you're ready to come out of the bath or shower, remember, keep your moisturizer in the shower stall. I know that sounds weird, but here, that's a really important tip. The reason is, in the shower stall, you know how it's all moist and warm? Well, that's where you want to dry off, and that's where you want to put your moisturizer on. So that's where you treat your skin to more moisturization, okay? And start with your feet, move up to your knees, up to your thighs if you need it, and of course, make sure your arms and the rest of your body is done. Most of the time, it's our extremities that are super dry and that you see all this flaking going on. The last tip is the following. Hot showers. Sounds like a dream in wintertime, right?
Yes.
Except you're basically kind of braising your skin a little bit. Okay, so braising your skin is probably not the best thing to do to your skin. So what I would suggest is, if you want to get into just relax your muscles and you want that warmth, go ahead, but start to turn the temperature down once you feel that warmth and you're more relaxed. Get to lukewarm, and then get to even a little bit cooler, so that by the time you come out, cool skin has less risk of being itchy skin, by the way. Hot skin gets more itchy. And the reason is very simple. The enzymes that break down our skin, because our skin is an orchestrated sequence of events, from production of more skin layers to desquamation, where these flake off, all of that is controlled by enzymes. So if you want to be more flaky more quickly, heat it up. But that's exactly what you don't want to do, okay? So you want to cool it down. So towards the mid portion of the shower, turn down to lukewarm, and then towards the end, get it even a little cooler, and then you're ready to go into the install toweling off, and then the moisturization part.
Huh.
And then after that, you're ready for, I don't know, namaste and yoga.
I would do the yoga before the shower, because then I feel
I love that
at
idea.
least I do hot yoga, so I just know I would get all sweaty.
I think that's perfect.
But I will be moving my moisturizer from upstairs down into the shower now that I know that.
Put it into your shower stall. You'll love it there.
Yeah. Okay, great. If it helps my skin, then I am all for that. So now we're going to be taking a short break to watch part 2 of the melanoma challenge. Feel free to participate in the chat on if you think it is melanoma or if it's not. And me and Dr. Tan will be back to answer the rest of your questions in 2 minutes.
Hi, I'm Ashley Gasvan, Executive Director of the Responsible AI Institute.
And I'm Melissa Lefebvre, Director of Partnerships and Market Development with the Responsible AI Institute as well.
Hi, I'm Jessica Levesque. I'm the Executive Director at C4, and I'm excited to do the Melanoma Challenge.
Hi, and I'm Josh McDougall, also from C4. Can't wait to do the Melanoma Challenge. This one's a bunch of different colors. That seems bad.
Yeah, I was going to say, it looks like
bad,
two
right?
different things.
Yikes, that's melanoma.
Yeah, melanoma.
It could just be like around someone's nipple. Is that a nipple? I don't know.
Oh, is that a nipple? It also almost looks like a blood blister.
It has everything. It has asymmetry. It has uneven borders, variety of colors.
Yep.
Evolution and diameter are tough, but like
Nipple blood blister, that sounds painful.
I would still get it checked out.
But if you look at those hair follicles, like, I don't know, it kind of looks like smallish. So like larger than 6 millimeters seems about right.
I'm going to say yes again because I would always assume everything's worse.
I have a high degree of confidence that this is melanoma.
It's the multiple colors that's freaking me out. Whether or not that means anything, I don't know. But I'm going to go with yes as well.
Yes.
Okay.
Yeah.
All right. Got
Aha. Do we find out if it's a nipple?
This one, I feel if I saw this on my partner, I'd be like, get to the doctor immediately.
No, this is not a nipple.
All right. So multiple colors. We'll keep that in mind.
Okay, welcome back. Did any of you guys in the audience guess if that was melanoma or not? We're now going to continue with the questions. Feel free to keep submitting them in the chat. The first one comes from Danny on Facebook, and they ask, on the dry skin topic, what do you suggest for those with sensitive, flaky, dry skin who can't handle latex, salicylic, glycolic acid, but still want exfoliation? What other options should we look for?
So the first thing I would do is to try to understand why they have sensitive, flaky, dry skin rather than launching into a product. So I would suggest that, usually with sensitive, flaky, dry skin, there's an underlying inflammatory condition. So start with that, get a proper diagnosis, and then address that problem because that might be all they need. The second part is usually when it's dry and flaky, they need a good moisturizer. They don't need an exfoliant. They need moisture. So delivering a moisturizer can be very, very gentle. Some of them are very nicely controlled. For example, you can start with a hydrating agent like hyaluronic acid and mineral water, and then move on to applying a surface cream to seal everything in. And that might be all they need. And over time, if they then start to think, okay, I do need a little bit of exfoliation, you can choose a product with a very low concentration of lactic acid. And I would probably put glycolic and salicylic acid aside because they can be a little bit more harsh than lactic acid. Lactic acid, by the way, is in milk. So I don't know about you, but apparently that was purported to be one of the beauty secrets of some of the Egyptian queens. And, it was basically using lactic acid to gently exfoliate. Now, if you choose the lowest concentration lactic acid, you can make it even lower. How do you do that? You mix it with your favorite moisturizer. Okay, so if you have a 4% lactic acid product, and that's the lowest you can find, mix it with your moisturizer, and now you have even a 1-to-1 mix gives you a 2% lactic acid. And if that doesn't irritate, then you can slowly escalate it over time.
Awesome. I would like to correct myself. I said latex, but I meant to say lactic. I read latex, but Dr. Tan corrected it and said lactic. So thank you for that.
No problem.
We have another question from Caitlin on YouTube. And they ask, totally opposite from the dry skin question, what product would you recommend for someone with very oily, acne-prone skin?
Yeah. Well, there are two things. One is, the oil is problematic because nobody wants to look like an oil slick, me included, by the way. So that's why I have all this matte makeup on. Okay. The second part is, the more oil we make, unfortunately, the more risk we have of having acne. So slowing down the oil is not a simple matter. There are products being developed over the counter now that seem to show in good research trials that they can slow down or reduce sebum excretion, which is remarkable because we've never seen that convincingly in creams before, but some of them are coming. There's a new product that's been launched in Canada that is prescription that blocks the androgen receptor. And those are the receptors underneath our skin that activate our sebaceous glands, our oil glands, to make more oil. So, and sometimes more oil, more acne. And that then directly impedes that binding. So that's another option to help. And then there are a number of hormonal anti-androgen pills that sit right in the androgen receptor, again, to reduce oil production. Now, there's been a lot of interest in whether diet and dairy intake can help acne. And one of the ways that might be impacting acne is through the sebaceous, the oil gland. And it does so by reducing oil production and modifying the quality of the oil so that it doesn't cause as much inflammation as it traverses the skin. Because the inflammatory oils can trigger inflammation that we know as acne. So that's an important part. Sometimes just paying attention to what you're eating, reducing your processed foods, reducing what we call the glycemic index is a useful way to try to help naturally reduce your oil production. But I have to tell you, some of the most beautiful patients I've seen who are in their 60s and 70s will tell me, I've always, as a young person, I had a lot of oily skin. And in my mind, it's because they're super hydrators. Okay. They just have all of that oil that's helping them hydrate their beautiful skin through youth. And then over the years, as their skin started to get drier and drier, they would put very thick emollients in their skin, like Vaseline. And if I ever had to do surgery because any of them developed problems that needed cutting, it would be like doing surgery cutting through velvet compared to doing surgery on a patient who didn't do any skincare. It's kind of like cutting through leather. It's that clearly different.
Huh. That's crazy.
Maybe that's more than you wanted to hear around dinner time.
It's okay. I already ate before this, so we're all good. The next question comes from Emma on Facebook, and they ask, do you have any non-steroidal treatment recommendations for eczema?
Yes, there are quite a few. There have been, over the past almost 2 decades ago, the release of a product group called the calcineurin inhibitors or the topical calcineurin inhibitors. That group includes, and I'll mention some brand names because that way when you go to your physicians, you can ask them whether that's something they would recommend for you. That would be Elidel cream and Protopic ointment. Now, those two were the first kids on the block that were non-steroidal that were clearly also helpful for atopic dermatitis. However, more recent ones have also been released. There's one called Eucrisa, and there are more on the way because there are very new mechanisms of action that have been determined to be able to help reduce inflammation without being a steroid.
Okay. That's interesting and really fascinating to know. The next question comes from Ankita on LinkedIn. And they ask how to prevent or treat atopic dermatitis more naturally or without steroid-based ointments or meds, which we just kind of touched on. So this is a great lead-in. And also, does some kind of food possibly trigger eczema, and how can I recognize or address that?
Yeah, that's a really good question, because it can be very difficult to understand what triggers eczema in an individual. And sometimes there's nothing obvious that triggers it. So one way to evaluate is to be your own Sherlock Holmes. And that is, whenever you get itchy and whenever you flare, is there something that's triggering it? So that way you can kind of define your triggers. And once you define your triggers, you can try to see what happens with your skin when you try to avoid or minimize that. For example, one of the triggers you and I just talked about is heat.
Mm-hmm.
And a lot of eczema patients, when they go to bed, it's at nighttime, they get very itchy and they start to scratch their legs. And the reason is the skin gets warm underneath the covers. Okay. So what we tell patients with eczema when they go to bed is, get under the sheets, get warm, and then just as about you're ready to fall asleep, get those big duvet covers off. So all I want on you is really kind of a draw sheet, but all the heavy stuff, take it off, because we don't want you to heat up, because then you'll start scratching. Because you know why?
Heat.
You can't cool down, like the song says, right? In the middle of the night.
Oh man, that's actually really interesting. I don't have eczema, but I do find my skin gets really itchy right before I'm about to go to sleep. So maybe I'll try this.
Yeah, stay really cool. Exactly.
Okay.
Try to cool down. And you know, the other thing is, when just before you go to sleep, you might be taking a hot shower. You might have changed out your clothes. And it's that change in temperature and humidity that triggers those itch receptors. Right? So, you know, maybe whenever you can, before you go to sleep, change into your PJs early, you know, and then when you go to sleep, you're not, you know, you're kind of changing the temperature just before, so that you can maintain that consistency.
Okay, I will try that, because this has just started recently, but that is good to know. We have another question from Rachel on Facebook, and they ask, do you recommend adding a vitamin C serum into someone's daily skin routine?
And before I forget, I think one of the other aspects of eczema triggers is, if you're not having any luck with finding your triggers, sometimes what will be useful is when you talk to your dermatologist, if your dermatologist is a Sherlock Holmes, they'll start digging more and more. The problem is sometimes it can sound like an interrogation. So it needs to be very gentle and nuanced, but you know, they might be asking about your pets. They might be asking about houseplants. They might be asking about your vacation destinations. They might be asking about what happens when you're out of the house and traveling in a hotel using hotel shampoos and soaps. So, because all of those are potential triggers, and if still nothing's turning up, then sometimes the allergist can do some testing just to verify that this is truly atopic, i.e., your type of a dermatitis that's personal to you and your genetics, versus contact dermatitis, which is because you're responding to an allergic contact agent coming in contact with your skin. Sorry, where were we?
I can repeat the question.
Okay.
Rachel asked on Facebook, do you recommend adding a vitamin C serum into someone's daily skin routine?
Yeah, you know, I think vitamin C serums makes a lot of sense, because there are a couple of things about vitamin C serums. In the year 2002, there were some landmark papers published on the value of vitamin C serums, even when people use sunblock. And what they showed was a reduction in cell damage from sun exposure. And that was pretty remarkable. So at this point, my thought is that there's no reason why you can't use vitamin C on the skin. And, you know, it will help to augment sun protection. Plus, the major caveat is, do you know whether the vitamin C serum that you're using actually gets into your skin? So that's the problem. right? Because not all C serums are the same. So just because it says vitamin C serum, it doesn't mean it's going to do what we think it's going to do, because that's why in my line of work, I always want to see the proof. If you say it's going to be an antioxidant, I want to see that it's actually being demonstrated in an experiment that it actually does that. So be very cautious, because many brands will say that, or say they have vitamin C, but when you actually ask them or test their products, there's very little vitamin C, and then they can't show you proof that it works.
Oh, in that case, what are some brands you would recommend that you do know have actual vitamin C in them?
That they've shown works?
Yeah.
So there are some very good ones. There's a Canadian one, Vivier, and they have a good vitamin C serum. There's also SkinCeuticals, which is the granddaddy of vitamin C serums, because it was that group that published that landmark article in the year just after the Y2K debacle. Thank goodness we're all still here. So, and they're the ones that move the needle forward in advancing vitamin C serums and antioxidant effect. There are also some other brands. There's Vichy, La Roche-Posay. There's a new brand that is going to be launching called Skin Better that also has a very nice set of antioxidants in it. So there's some excellent brands out there. The way I would suggest you look at vitamin C serums is look at the big brands, make sure you trust the name. And here's the thing. The bigger the name, the more they have to lose if they come up with a loser product, right? If it's a small brand and they come up with a loser product, they can shut up shop and they go away.
Right.
But these brands have a reputation that they need to continue. The other part of it is they also have a big research budget that they can make sure the right stuff is in there to show you that their products work.
Okay. I will go buy one of those, because I'm pretty sure my vitamin C serum now is not one of those brands, so I will.
But I have to tell you, Olivia, if it's working for you,
it does
that's
work.
Fine. Yeah. So the question is, how do you know it's working? Right? That's the problem.
No idea. I just know it makes my skin look really good when I use it.
And that might be all we need. If you look good and you feel good, I think that's fine.
Great. Then I will keep using it. Next question comes from Quinn on YouTube, and they ask, what can you do to help hyperpigmentation / dark skin, for example, like dark underarms?
Yeah, dark skin, sometimes we call that hyperpigmentation, and there's usually a cause for it. So in the neck area, underarms, sometimes the groin area, there's a condition called acanthosis nigricans that can be familial or can be related to hormone issues. So one of the first things is, what is causing it? And sometimes there's no obvious cause, it's just there. And if it bothers a patient and it's just there, there's no underlying hormonal problem, then we can look at fading creams. And these creams have very specific ingredients. Those would include products like hydroquinone, fuchiol. There can be some glycolic acid in it because that helps to exfoliate. And then tranexamic acid. There are lots of different products that can be used to try to help fade or lighten the skin. But be very cautious with the underarms, because when you apply some of these products in the underarms and your arm closes, then it's occlusive. And any little area of irritation can compound because now you've just blocked everything in. So a minor irritant can lead to a major area of irritancy because of that occlusive effect.
Oh, okay. Good to know. Very informative. Now we're going to go to the Melanoma Challenge Part 3. So if you feel like playing along, once again, you can do it right here in the chat, and Dr. Tan and I will be back in just a few minutes.
Hi, I'm Ashley Gasvan, Executive Director of the Responsible AI Institute.
And I'm Melissa Lefebvre, Director of Partnerships and Market Development with the Responsible AI Institute as well.
Hi, I'm Jessica Levesque. I'm the Executive Director at C4, and I'm excited to do the Melanoma Challenge.
Hi, and I'm Josh McDougall, also from C4. Can't wait to do the Melanoma Challenge.
Oh, that's just a mole.
I don't know, it looks smooth. It just sort of looks like a regular mole.
Kind of looks like a birthmark.
What's in the middle there? Like
there's like a little raise there.
Yeah.
It's got it's got a little raised.
Yeah, and also like the borders on this seem pretty defined.
Yeah, I'm gonna say no, although I would definitely get that checked out.
I'm gonna go with a no on this.
I am as well.
I think we got to disagree on one, so I'm going to go with yes, just to be the devil's advocate. I don't know if I've ever disagreed with you, Jess.
Yeah!
No.
Ooh! So let this be a lesson to disagree.
Never disagree with Jess again.
I think collectively as a diagnosis team that we are very good.
The dermatologists watching this are like, yeah, cute.
Does this make you also want to go to the dermatologist and get checked out? Because it's working for me. Yeah, so I would say the takeaways are that we're not great at judging ourselves if something is melanoma or not.
But this asymmetry, I didn't know. The border not being defined, I didn't know. The color of it being two different colors, I think is really interesting.
Erring on the side of caution is not necessarily a horrible path forward.
I don't think about this a lot for myself, but when I think about my partner all the time, I'm always keeping an eye.
Partially why this sort of thing's important, recognizing you can't tell if something is melanoma or not. So if you're concerned, find a way to go to the doctor.
Okay, did you guess it was melanoma or not that time? Let us know. Thank you so much for participating in the Melanoma Challenge, and it's now time to answer the last few questions of the evening. So the next question is, do I need a referral to see a dermatologist?
That's a good question. In general, for most places in Ontario, if it's for a medical issue, like eczema, psoriasis, odd mole, question mark, could it be cancer? That comes into the medical territory. And for most dermatologists in Ontario, they'll require a referral from your primary care physician. On the other hand, sometimes there will be questions that are related to, gee, what's the best skincare program I can start on? I'm wondering about some aesthetic treatments. Those come outside of the medical purview of the Ontario Health Insurance Plan. So they're technically non-insurable, those types of concerns. And then that one, you don't need a referral.
That's great. And one of the great things about GetSkinHelp is you don't need a referral to see someone about your skin concern. So if you're watching this and you think you have a suspicious spot on your skin, or you have eczema you need checked out, we are a no referral service. You just need either a valid OHIP card or private insurance, but no referral otherwise, which is great. Okay, moving on to the next question is, spray sunscreen better than cream sunscreen?
Quite frankly, for people who don't wear sunscreen, anything is better than nothing.
True that.
Now, if they do wear sunscreen and they're thinking, which one should I choose? I would try to encourage them to use the creams. And the reason is that you can determine the amount that's being applied more accurately. So in the lab, by the way, 2 grams per centimeter squared is the test amount. Okay, so if you actually translate it to how much you'll need on the face, it's about almost the size of a nickel or a little lima bean that's required. So, that's the amount that would be equivalent to the 2 grams per centimeter squared. So when you use it in a spray, you just have no idea how much that would be. That's the problem. Plus, remember, some of the sprays can aerosolize, right? So if you're out on the golf course at the beach on a windy day and you think you're spritzing yourself, you might be spritzing your neighbor down the next cabana.
I've been on the receiving end of that. Although I will admit, I love spray sunscreen because it's so convenient when I'm like on the go. I have it in my purse and I just spray it on. But if cream is better, I'll use it.
And you know, that's the thing. If it's convenient and you're going to use that rather than the cream, at least that's better than nothing. Absolutely.
Yeah, exactly. The next question comes from Alafia on LinkedIn, and they ask, I have had a small lymph node on my neck for almost a year. It is the size of a pea, but it doesn't bother me. Lately, I'm a little more concerned about it. What could it possibly be, and what should my next step be?
Well, lymph nodes, when they enlarge, remember, we're not even quite completely sure it's a lymph node. It could be a prominent oil gland, and sometimes the material that is captured in that gland is called an epidermoid cyst. And sometimes these structures can feel like little nubbins under the skin and be mistaken for lymph nodes. Now, presuming it is a lymph node, then the question is, why would it persist, and is it of any consequence? So lymph nodes get big usually because of pre-existing inflammation in the drainage area of that lymph node. Lymph nodes are kind of the police stations of the different types of homing cells that detect danger on our skin and our bodies. So when these cells detect a problem or it's inflamed, then it enlarges the lymph node. And sometimes they don't necessarily come back down to complete normality. They just stay a little bit enlarged, but it doesn't mean it's a problem. Sometimes it is a problem. And those problems can be different conditions that lead to enlarged lymph nodes. So I think if you're not quite sure, it's probably a good idea just to have your doctor verify. Because, for example, if it's one node, and then he examines and he finds 2, 3, 4, 5, 6 nodes, and then other nodes are enlarged, then it launches a different set of investigations. If it's just one lymph node, you feel fine, you're not losing weight, you're not having problems with night sweats, and you have had no issues with significant infectious diseases, and your review of systems is otherwise well, then it's probably not a consequential problem. But your doctor should check that out.
Yeah, that makes sense. The next question is, staring at my computer all day, dangerous for my skin? And I'm curious about this because I spend all day looking at a computer because of work.
Well, it could be very dangerous for your skin if it encourages you to do bad things to your skin, right? But by itself, I think the question is really about blue light. So the blue light spectrum from computer screens by experts who evaluate the amount of blue light we get from screens compared to the amount that's in outdoor sunshine is negligible. So you should rest assured that whatever you want to blame on your computer, skin damage is not one of them. And if you're super bothered or irritated by it and kind of a little paranoid, you can always put sunblock on.
I put on sunblock on my face every morning, so maybe it's helping my skin.
Perfect.
But that is good to know. As long as I keep up my skincare, I don't got to worry about my computer harming me, at least in that regard.
No, exactly.
The next question is, how do you think technology can help dermatologists?
Technology in dermatology, quite frankly, we use a lot of tech in derm. For example, I've just recently bought a skin ultrasound device. Oh. And because what we want to do is to be able to look beyond the surface. So if there is a node underneath the skin, what's in that node? Is it solid? Is it got oil in it? Is it got pus in it? And if I need to cut into it, are there vessels beside it? So I think technology can be a huge help. Now, beyond that, of course, the technology, including AI, can be hugely helpful for us because many of the things we do repetitively over and over and over again. And that's completely unnecessary in this day and age. We don't have to ask the same questions and give the same counseling about skincare like I just did for the shower and hot water. But, I do that routinely. So, it might work better for it to be some way to provide that information and that content to patients who can use it whenever and wherever they want to just review that, as opposed to waiting for me to provide that information during that very short encounter for that one person at that one particular time. So
Right.
I think that is changing over time. And of course, the diagnostics in terms of imaging are changing and improving. So I think that's been extremely reassuring for us, because the hope is that it allows patients a sense of consideration that their concerns are being looked at
Right.
on a timely basis. And then there is a potential triage pattern that high risk and medium go more quickly to biopsy or to a visual exam by the derm. And low risk, at least it reassures the patients, and then they can either have another scan done 3 months or 6 months later, or if they still want to see the derm, they can, but at least they're more calmed and anxiety reduced because they've had this reassurance that their lesion is low probability.
Yeah, I think it's great that technology is doing so much for the medical field. It's super important. Okay, our final question of the evening comes from Alessandro on YouTube. And they ask, any recommendations for choosing a shampoo for oily scalp with acne?
Yeah, usually when acne develops on the scalp, it's a condition called folliculitis. And folliculitis is inflammation of the pores. Within those pores, the inflammation can be triggered by either bacteria, yeast, or oil. Okay, and usually on the scalp, it's going to be bacteria or yeast. How we decide on what it is going to be based on whether it itches or it hurts. Usually, itching is more likely a signal for yeast. And if that's the case, then you start using some of the dandruff shampoos, because a lot of dandruff is triggered by the same yeast. So whether you use Nizoral, Head and Shoulders, there are a number of very good shampoos that are targeting yeast forms. That would be extremely helpful. If it's bacteria, it tends to hurt more. And in that situation, then we start looking at using some of the antibacterial cleansers. And Hibiclens, Terseptic, benzoyl peroxide, by the way, which is used for facial acne as a cleanser, can be used in the scalp. But we get patients to massage it into their scalp, rinse it off, and then shampoo, because benzoyl peroxide will do nothing for flouncy, bouncy hair, which apparently people want to have, who actually have hair, which I don't.
Yeah.
Yes.
Flouncy bouncy is what we all want to achieve with our hair. Okay, so before we end off our evening, we have one final video to share with you about GetSkinHelp, and once again, Dr. Tan and I will be right back.
GetSkinHelp is your skin health champion. We use virtual health to bring the doctor to you. We developed artificial intelligence that allows you to screen for skin cancers and other diseases from anywhere. And now we're working with the government so that you can always have your health data stored on your phone. We're doing this all because we understand that you are the patient, and you should always feel in control of your health.
Okay, so we're actually going to squeeze in one last question before we wrap it up. Felicia on LinkedIn asks, does melanoma have any genetic drivers?
Yes, that's a good question. Melanoma has a number of genetic drivers, and some patients, unfortunately, do have a genetic tendency in their kindred. So the issue, and there are a lot of patients who don't have genetic drivers, but the ones that do tend to have some of the genetic mutations that lead to breast cancer, as well as to melanoma and other forms of internal cancers. So yes, indeed, there are some.
Wow. Well, this was super fun, and I personally learned a lot, and I hope the audience did as well. This was great. Dr. Tan, it was so great to see you. Thank you for joining us and answering all of these amazing questions.
Oh, it's my absolute pleasure. You know, the reason I want to be here is to answer questions that are relevant to people who have skin concerns, and then to try to give them practical, useful advice so that they can move on with any of their skin issues and bring them to their physicians or to GetSkinHelp if they feel so necessary.
Yeah, so if you would like to learn more about the incredible Dr. Tan, you can visit healthyimage.ca, and you can also check out his patient decision aid at informed/decisions.org, or dash, sorry, not slash. That's informed-decisions.org, and you'll be able to keep up with all of his amazing, incredible ventures that way. And finally, make sure to go to GetSkinHelp.com to book your skin check appointment. If we brought up anything tonight that you think you may have on your skin, feel free to get it checked out. And as a reminder, it's covered by OHIP, and there's no referral needed. So make sure to go get your skin concern checked out. Thank you so much, everyone, for tuning in this evening, and we will see you all again soon.
Yesterday, the CBC National aired a touching story about a woman fighting melanoma on her leg. It started as a mole, but she delayed having it checked out due to the pandemic and other reasons. And it wasn't until after months and months of being pestered by her partner that she finally decided to do something about it. Now, we've included a link to that CBC story in the description. Now, stories like these are all too common in Canada, and here the CBC does a great job of highlighting the problem. But there's a lot the CBC didn't tell you. There's so much more to fighting melanoma and other skin cancers than just see mole, check mole, remove mole. And if you want to understand the ins and outs of the skin cancer journey and go behind the scenes with the different tests and appointments and find out how the healthcare bureaucracy really works, then I invite you to read Maria's story with melanoma on the GetSkinHelp website. It's shocking. And I really hope that you see it as a cautionary tale that it's meant to be, and how important skin health is when it comes to your overall well-being.